And then for the stretches, we have basically the two or three from the knee that I forgot to go over, the quad and hamstrings. So we can just touch on that real quickly. And these actually all go together. Right? Someone with hip problems or knee problems, generally, depending on where their tightness is, these are all appropriate stretches to do. So a quad stretch could be something like this. We thought this would be probably the easiest because you don't want, sometimes it's really hard for them obviously to get in this position. This way, if they have a lower chair, it will give them just enough of a stretch and they can kind of monitor how low they want to go with that. They can also use a strap or like a belt if the chair doesn't work for them. But that would be the quad stretch. The hamstring stretch you can do in a chair. And just keeping the back straight is the most important one for this. And they can lean forward, or again, they can kind of have a strap to do a calf stretch at the same time, which is kind of nice to do both. And then the Gastrocnemious Stretch, just against a wall. You can just do some podium. Keeping that heel down on the back foot. And then the biggest thing here is to watch out for the external rotation. So a lot of the time the patient will want to do something like this. So making sure that they're in the proper alignment and that that foot's facing straight forward. So all the stretches, the general rule of thumb is about 3 sets of 30 seconds to make a difference in the length of the muscle. And then for the hip specifically, the Pyriformis and hip flexor stretches. The Pyriformis stretch, you can do the figure 4 when you're laying on your back, or just a simple seated version where they can pull it towards the opposite shoulder, or they can kind of lean forward and open the hip and push into it. You just want to watch for any of that anterior hip impingement or pain. So I just kind of play around with what the best angle is to get the stretch, but not the anterior hip pain. And then lastly, the hip flexor stretch. So kind of similar looking to the quad stretch, but you would go across this way. So basically this one. So you can put the leg on here and then kind of lunge forward, but just make sure that they're keeping their back neutral and that they're actually feeling it in front of the hip and not in the back. If they kind of bend forward, they're just going to miss the stretch in the anterior hip.